Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers! In today's episode, we're diving into a survey-based study that explores how two key professional groups, veterinary neurologists and veterinary rehab therapists, approach the diagnosis and management of degenerative myelopathy in dogs. This research sheds light on everything from diagnostic protocols and referral habits to treatment goals, assisted device recommendations, and how we support our clients through this challenging condition. So whether you're working in neurology or rehab, this episode gives insights into how our professions intersect and where we can collaborate more effectively to improve the outcome for our patients. The Vet Rehab Summit 2025 is happening on the 8th of November, and we couldn't be more excited. This is our annual online conference for veterinary rehabilitation professionals, and last year we had over 5,000 of you that registered to join us. A big thank you to our gold sponsor, the Veterinary Academy of Higher Learning, to help make this event possible. The theme this year is Dynamic by Design, and we'll be diving into canine and equine anatomy in motion, covering muscle activation, biomechanics, therapeutic exercise, and how to apply movement science in clinical practice. Now, early bird tickets are available, and we also have a limited number of free live access passes. So if you're thinking about attending, now's the time to grab your spot before they're all gone. You can go to vetrehabsummit.com for all the details and to book your tickets. A quick word from our sponsor before we dive into today's topic. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts offer effective, innovative, and proven solutions. You can sign up today to receive a one-time special gift for all our podcast listeners with your next order. You just got to head over to the special link, pawprosper.com/OPH. And of course, you will also be able to see the Paw Prosper and all their brands on the 8th of November at the Vet Rehab Summit. Right, over to our survey-based study.
Good morning and welcome to this month's research refresh on our small animal platform. Today we are looking at a relatively new study, a 2023 study. I can't believe that already makes it 2 years old. That's a little bit wild, but okay. And we're looking at a survey of neurologists and rehabilitation professionals that looks at the diagnosis and management of dogs with degenerative myelopathy. It was published in the Journal of Veterinary Internal Medicine, and we've got Taryn Boucher, Joan Coate, Sarah Moore, and Dominic Fraser as authors, Natasha Olby as well. I missed her there, and Mark Rishnew. So I am not familiar with any of these names, but you guys might be. Let me know if you are. The objective of this study was to describe current practices of neurology clinicians and rehabilitation professionals in the diagnosis and the management of degenerative myelopathy. So the methods, they set up two separate surveys, one for neurology clinicians and another one for rehabilitation professionals. They used an online survey platform, and they ran a trial survey before they actually distributed it. Their goals were to determine how do clinicians make a DM diagnosis and how are dogs managed after that diagnosis. All right. So the survey was essentially divided into three sections. They collected demographic information as well as their experience, the practitioner's experience in working with DM. And then they asked closed-ended questions with choice options around the diagnostic approach of diagnosing DM. And then the third section was both closed and open-ended questions around the treatment of DM. The surveys were distributed via email to the ACVIM and ECVN Neurology listservs and the Vet Rehab Rehabilitation listserv. Participants were given 2 weeks to complete the survey, so they ran it for a really short time. And then their data analysis, essentially this was a descriptive study, so they looked at the responses to questions, they summarized them, and then they expressed those as fractions and percentages. This is an open access paper, so you can go and download it. So they had 190 responses from neurologists. We're going to look at the two surveys separately. 190 responses from 17 countries. The most respondents were in the US, UK, and Germany, and then there were also respondents in Italy, France, Canada, Australia, Spain, Switzerland, Netherlands, Portugal, and a few other countries. 168 of those were neurologists, 17 were neurology residents, and 5 were clinicians practicing in neurology. And then there were also 7 respondents who had already retired. Okay. So this table outlines the frequency of diagnostic tests utilized by neurology clinicians when making a presumptive diagnosis of DM. So just a reminder that we can't definitively diagnose DM while the dog is alive. That can be done post-mortem, but for the purposes of treating, we need to make a presumptive diagnosis of DM. So most clinicians are using, so 75% will always do an SOD1 gene test, right? 22% will do that sometimes, and then 2% never do that SOD1 testing. And then we also see that 43% are always doing a spinal MRI, but 53% will only sometimes do that spinal MRI. So this, we do the SOD1 test, and then maybe we do a spinal MRI. Maybe we do or maybe we don't do a spinal MRI. CSF analysis, most often they're not doing a CSF analysis, although they might. And electrodiagnostics are very rarely to never used. And then other tests could include blood counts and serum biochemistry, infectious disease testing, an orthopedic exam, so x-rays of the vertebral column, the pelvic limbs, and the hips, and post-mortem histopathology of the spinal cord. So I'm actually surprised that an orthopedic exam isn't a part of this, that we're not looking at the x-rays of the vertebral column, the pelvic limbs, and the hips as sort of a primary part of this. Again, remembering that we're really ruling out causes of low levels of ataxia in these early phases of the disease, or the early presentation of the disease. So in our group of dogs that are predisposed to DM, hip dysplasia and SI issues, lumbosacral issues, lumbosacral stenosis, these are all areas that are commonly affected by orthopedic pathology. So I'm quite surprised that that is falling into the other, never. Even though you're a neurologist, that's fine, but a basic orthopedic exam makes sense to me. We're ruling out causes of low degree, mild ataxia in the beginning phases of this condition. So that's my thought. But okay, then in terms of treatments, so neurologists don't treat this in general. They're actually referring on. So 53% of neurologists will recommend that patients come back for regular checkups. 30% recommend that the owner goes back to the primary vet for checkups after the presumptive diagnosis is made. 15% do not perform or recommend rechecks or checkups. The recommended timing of checkups varies from 4 weeks to annually. So the 53% that will be performing rechecks, they're usually recommending every 4 to 6 weeks. So I like that time frame. That makes sense to me. It doesn't make sense not to follow up with these patients unless they are in a full rehabilitation program. Then yes, they're going to get referred back to their neurologist or their primary veterinarian if there's an issue, if there's something that needs to be checked. But okay, the recommended timing of recheck exams varied from 4 weeks to annually. So that annually doesn't make any sense for this diagnosis, but okay. And then in terms of care recommendation, they've provided this table for us. Most neurologists are actually referring for physical rehabilitation. They're recommending regular exercise, and they are talking about assistive devices. And those assistive devices include booties or socks, harnesses, and then wheelchairs. So not necessarily straight to wheelchairs, but they're talking about ways that we can support. And then very few are recommending dietary changes or the addition of vitamins or minerals. And then when it comes to client support, 55% of neurologists provide resources about DM, and that could include handouts, specific websites, primary literature, information on support groups, and then quite a large percentage actually provide lessons or resources on bladder management. But again, for this condition, bladder management only comes into play much later. So how are we supporting owners in the early phases of this disease progression? And then end of life statistics. So when they were asked when owners opt to euthanize their dogs, 60% of owners euthanize their dogs when they become non-ambulatory paraparetic. So they still have some function, but they can't walk without assistance. 32% will euthanize when there's paraplegia and incontinence, so they've lost function in the hind limbs and they've become incontinent. And then 2% will euthanize at ambulatory paraparesis, so really early on in the game, and 1% will go all the way to tetraplegia with respiratory compromise. Okay, so looking at rehabilitation professionals, there were 79 responses from 8 countries, with most of those in the US, Canada, and the UK, with additional responses from Greece, Netherlands, Australia, Russia, South Africa. 43% of respondents were veterinarians with a CCRT qualification. Then 23% were non-veterinary CCRT qualifications, 8% rehab technicians and assistants, then ACVSMR, and then we also have a percentage of veterinarians with no additional certification or qualification, and 15% other. And these were essentially people who were becoming qualified. I think there was one human PT, so a variety of different ways into the profession. Then 53% treat 1 to 5 DM dogs annually, and 6% treat 20 plus cases annually. So that is a lot of degenerative myelopathy. If we are talking about diagnosis, so 49% of this group did perform diagnoses. All of those were veterinarians. And they, again, 59% always test for that SOD1 mutation. 10% perform spinal MRIs, and 5% perform CSF analysis. I think the nice thing with rehabilitation professionals is that we know some form of orthopedic evaluation is happening, but they haven't spoken about that here. They haven't looked at it. And I do think that's worth considering and thinking about, is we do need to look at hip dysplasia and lumbosacral stenosis when we're making sure that we're ruling out all the differential diagnoses for these guys. All right, treatment. If we go into treatment, there's a lot to look at for rehabilitation practitioners because we're really spending most of our time treating these dogs. For most of us, our role isn't in the diagnostic department, it's in this treatment and management, and that is quite a long-term process. So starting with therapeutic goals, 99% said that they were aiming to preserve or improve strength. 98% is looking at improving coordination, 43% reducing pain, 30% reducing spasticity. And then other goals listed were client education and support, treating compensation pain, delaying progression of disease, maintaining activities of daily living, and supporting them with assistive devices, providing support with assistive devices. So I think that's very interesting because this isn't generally a painful condition. Of course, we are treating compensation pain, but it's not primarily painful. And then if we're looking at increasing or improving strength and coordination, I also find those really interesting goals. I don't necessarily disagree with them, but there are some caveats to that we should be thinking about, and I'll refer you to some resources at the end. Okay, in terms of therapeutic interventions, primarily 95% home exercises, then 82% strength building exercises. Why is that twice? I don't know, sorry. Then underwater treadmill, gait training exercises, land treadmill, adjunct therapies, laser therapy, acupuncture, PMF. Home exercises, primarily we're looking at regular walking and then personally developed exercise programs, which include simple exercises like perturbations and sit to stand exercises. So really this hasn't gone into a whole lot of detail on what the programs are that we're developing and what they look like, but it does give us some information. Okay, 94% will use assistive walking devices, and again we're talking about non-slip footwear and harnesses, and then wheelchairs or carts towards the end stages of the disease. 52% did recommend supplementation and 35% diet changes. So I think that's interesting and good because we are always looking at a holistic approach. The frequency of in-clinic appointments. So again, I find this quite interesting. 43% recommended once weekly treatments, 32% twice weekly treatments, 5% every second week, and 1% once a month. So I find that interesting. I like that most of us lie in that 1 to 2 times weekly. And then, of course, there were a few who said that it really depends on the owner's resources, time and financial resources, and what their capacity is. And of course, it always comes down to that, and we work with what we can. Okay, the perceived effective treatments, I think that's quite interesting because 73% of rehab professionals felt like they were able to maintain strength. 71% felt that they were able to maintain or improve coordination, 71% maintain or improve muscle mass, 68% perceived an improvement in the well-being of their patients, and 91% believe that treatment delays the disease progression. So that's really powerful stuff. Even if that perceived effective treatment is a perception and not a true reality, which there are some studies actually that show a much longer lifespan for these guys when they're in rehab programs. But even if that effect is not real and it's only perceived, that is still very powerful for us. And we need to tap into that and believe that, and I love that. So if you want to know more about that kind of perceived effect, I would recommend watching UNC's latest webinars because they talk about that and I don't mention them at the end, so that would be a good one. Okay, then let's look at euthanasia or end of life. So when are owners choosing to pursue euthanasia for these dogs who are in rehabilitation programs? Okay, so we see very different numbers actually from our other group. A smaller percent, 18%, are euthanizing at this non-ambulatory paraparesis phase. And then 48% are euthanizing when there is incontinence with or without paraplegia, or paraplegia with or without incontinence. So Yeah, that's interesting. And then a 9% are euthanizing at paraplegia. So I'm not sure how and why they divided these two up. I would have said paraplegia with incontinence and then paraplegia without incontinence and tried to, separate them like that. To me now, there's a lot of overlap here, and I don't know how to separate those for myself. And then tetraplegia without respiratory compromise, that was a whopping 18%. So a lot of clients are taking their dogs really far into the progression of this disease, and then 4% all the way to tetraplegia with respiratory compromise. Okay, and if we compare that, those numbers between the two professions, so the neurologist's experience and the rehab professional's experience, right, we're seeing this high number in the initial phase, right, up to 60%, and even a small percentage at ambulatory paraparesis. So the majority of patients for neurologists are actually ending their lives really early in the disease progression, with some, just over 30% going on to the point of incontinence. Whereas if we're looking at rehabilitation professionals, this paraplegia with or without incontinence is kind of the primary point, and then a lot of patients are continuing on further into the progression of the disease. So why is that? I think that this difference is due to a few things. First of all, we know that, or there has been actually quite a lot of data that the median survival time for dogs with DM can be significantly lengthened when they're in rehabilitation. So now our median survival time ranges from 10 to 36 months, whereas a few years ago, it ranged from 10 to 12 months. So we've pushed that survival time from a year to 36 months. And we've seen that increase in survival time within rehabilitation programs or protocols. So I think that's very encouraging. And that can also account for, they didn't mention a timeline in this paper. And I think that's sad, because this paraplegia with incontinence within the group of rehabilitation professionals might be at 14 or 16 months, whereas this is happening at month 8 or 9. So that's a guess. That's just a guess that I'm throwing out there, but it would be really interesting to compare the timelines with this information and this data. And the other part of it is that owners who pursue physical rehabilitation might be much more motivated to manage dogs with DM for longer than those who do not. And let's not forget the support that a rehabilitation facility provides to an owner. If they have support, education, a community, it plays such a big role in helping them feel able to and empowered to manage and handle the challenges that come with a condition like degenerative myelopathy. So I think that's quite interesting and relevant, and I like it. Okay, so I did touch on this earlier, but diagnosis with only an SOD1 mutation test isn't sufficient to really diagnose. It only tells us that the dog is predisposed to developing DM or at risk of developing DM. Okay, however, we also know that a spinal MRI is really expensive and that might not always be available. And if we're decently sure of the diagnosis and we've ruled out some other conditions, but this is again why I'm like, well, why aren't we just doing x-rays? But okay, I am not a veterinarian and I don't do diagnostic testing, so this is just me wondering out loud, right? Spinal MRIs are very expensive, and that cost could be inhibitive, especially when we're pretty sure, decently sure, that the owner is going to have a high financial investment that they're going to need to make into their dog's management and care for the next year to 3 years. Okay, so if we look at ongoing care, that's usually provided by rehabilitation professionals, and I like that the neurology professionals are referring to rehab professionals, a very large percentage of them. So I love that that is now easy to do and happening more and more. From our rehab professional side, there's a very strong focus on exercise as the primary treatment. And then we report there's a delay in the progression of the disease. So I think that's really great. Another thing is that the majority of rehabilitation professionals were in agreement on the most commonly used treatments, suggesting that potentially we can create a core standard protocol that it could include home exercise, strength building exercise, hydrotherapy, etc. I would be throwing laser into that as well. Yeah, so I think that it would be possible for us to, at this point, start to develop some treatment protocols, rehab protocols for DM, so that we have a better standardized idea of how we're working this with these patients. And of course, as with everything, every patient is an individual, but it helps if we know, what the laser parameters are, what the frequency of treatment is that we're aiming for, and what the modalities are that we really want to focus on. Okay, so on that note, I like I said, we have some great resources in the membership already on degenerative myelopathy, so I want to encourage you to go look at them. The first is another research refresh, where we looked at 2 different photobiomodulation therapy protocols combined with rehabilitation therapy, and there was a significant difference between the 2 photobiomodulation protocols, and that to me is enough for us to really start incorporating this laser protocol into our practices, into the rehabilitation of these patients, or the management rather of these patients. And then my next favorite is hydrotherapy and the DM patient. It's not a strength issue with Carrie Adrian. This is fantastic, guys. Watch this webinar. It's in the hydrotherapy platform. Watch it again, watch it again. Okay, so Carrie actually referred to this article in her webinar, which is where it came to my mind, or came to my attention, and I wanted to pursue it for a research refresh. But she speaks about this not being a strength issue and really highlighting a foundational core issue in how we're approaching degenerative myelopathy, and we can make that connection or we can make that assumption or that line of reasoning because of its connection to ALS or its relatability to ALS in people. Please go watch this, because if our primary goal is to strengthen the dogs, we are definitely missing something. So go watch that. Okay, and then a degenerative myelopathy and your role as a clinician by Debbie Taraka, another webinar with Teresa Pancotto, and adapting mobility to the changing phases of the disease with Kirsty Oliver. All great webinars. Start with Carrie's, start with the photobiomodulation one, and then let me know what you guys think. I think it's time for us to put together a proposed standardized protocol for the treatment of DM. I think that's how I feel about this. I think we're ready. I think we have quite a bit of information, quite a bit of anecdotal evidence to support putting together a program. I think this study helps us get even closer. So I think, it would be great to see that in the future.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.